Hello, do you guys hear me? I don't know how to use YouTube. Do you guys see me now? Do you guys hear me? Hello, everybody. Welcome to my stream. I am a YouTube boomer. I don't know how to stream on YouTube. This is my training arc. I don't know how to stream on YouTube. I'm so sorry. The last time I streamed on YouTube was like... When was it? A long time ago. Last year, yeah, the last time I streamed on YouTube, it was last year because I couldn't stream on Twitch. I was playing Ghost of Tsushima. I wanted to stream it and then Twitch was broken, so I streamed on YouTube. It was like so scuffed. Hello, okay, let's see who's here. Okay, I am totally new at using YouTube. I mean, like going live on YouTube. I'm not that good. Hello, iMac. Hello, Lemon Croissant. Kyle Hoot Hoot. Hello, Drac Black. Hello, Phil. Hello, Nashina. Tim. Hello, Shindo. Hello. Oh God, there's a lot of you. Hello, everybody. Welcome to my stream. Hello, Ruby. Yes, I'm on YouTube. All my medical education streams will be on YouTube now. From now on. There's never enough Yeah, I'm gonna do all my medical education streams on YouTube. So, my medical education streams are once a month. So, once a month I'll be streaming on YouTube, basically. Basta, anytime I do a medical education stream, it's gonna be here on YouTube. I'm gonna be talking about the thyroid. Okay. Totally. God, I am very new to this interface of YouTube. It's so different. Oh God, this is what happens when you're a Twitch streamer and then you suddenly jump into YouTube all of a sudden. YouTube scares me. Okay, wait. Let me open up my PowerPoint. Hold on. Let me prepare the PowerPoint. How are you, Shiori? Bench, I'm good. Where'd my PowerPoint go? Oh, here it is. I think this is it. Excited to listen and learn from you. That's good. Alright, hold on. Let me fix it, hold on. Cause I need to make sure that okay. I'm gonna set up there we go. I'm gonna set up the PowerPoint. Hold on. This is going to be on. There we go. Oh my God. That was the sound of a Twitch follow. That was the sound of a follow on Twitch. I forgot to turn that off. Wait. Wait, hold on. What the heck? You're gonna be hearing follows from Twitch this time. Alright, anyway, let's go. We're gonna go start. Alright. Thyroid! This is scuffed, I swear. Alright! It says VR chat. Oh my God, I forgot to edit that. That is supposed to say medical education. Education. Alright. Yeah, you might hear random beeps. If you hear random beeps, that's from Twitch. Look at this. Even my follower bar is here. This is a Twitch follower bar. It's still here. Wait, let me take that out. There we go. Twitch follow bar. Yeah, I'm sorry guys, because this is my I don't really stream on YouTube. I'm more of a Twitch streamer. So this is very scuffed. Alright, so today I'll be talking about thyroid. Okay, the thyroid is a gland. It's found in the neck. Thyroid. VR chat education. I would, you know. You know what? I plan to get my own world in VR chat. It'll be like a Sharipon world where I can have a classroom and then I could do my medical education streams there in 3D. That would be really cool. In virtual reality too. It'll be on VR. Anyway, so we're going to talk about the thyroid. This is actually a complicated organ. It's a small organ found in the neck in the neck, and it's not really easy. Even I have problems with thyroid. To be honest, I have a hard time. I also have hard time with thyroid. Thyroid is actually a challenge for me. Oh no! Wait, what? Why did my alert not show up? That's weird. The alert didn't show up! Why? Oh no. Why did it not show up? Hold on, that's weird. I'm gonna put that. I'm gonna. The alert didn't show up! Oh no. I think it's this. There we go. Let's put that there. Alright. Should be there. So, let's go to the anatomy of the thyroid. Alright, so like I said, the thyroid's on the neck. So I just grabbed this picture on Google to show you. This is the neck of a person. Okay? And the thyroid is here. This over here. This right here is the voice box. This whole thing. Okay, this whole thing is the voice box. This right here is the trachea. And the trachea connects to, it branches out at in the chest, called the bronchi, and it connects to the lungs. So when you breathe, the air passes through here to the trachea and to the lungs. Okay? And the thyroid is situated right here on top of a little bit on top of the trachea, a little bit on the higher on the neck. This thing right here you see here is the thyroid cartilage. In males, it's very prominent. So this was actually your Adam's apple. If you guys have a very prominent Adam's apple, that's your thyroid cartilage. That's this right here. This one, it bulges out. That would be it. Okay. All right. And yeah, it's part of this part. Is the inside of this is your voice box or the larynx. The scientific term for a voice box is the larynx. Okay. So when you look at the thyroid, you got the right lobe. The right is over here because you're looking at the person, and the person's right is this side on your left, and then this is the right side. That's why this is the right lobe, and this is the left lobe. And then the middle part of the thyroid gland is called the isthmus. That's the parts of the thyroid. Alright. Trachea blocks water to not go to your lungs. No, that's not the trachea's job. That's not the trachea's job. Actually. The trachea is just a pipe. It's like a pipe leading to the lungs. Alright, so let's go next. So what does the thyroid do? It's actually kind of complicated. The thyroid is quite complicated. So I got this photo. I will explain it and simplify it. The thyroid gland it's a gland that produces hormones, okay? And their hormones are called T3 and T4. And it also produces calcitonin for the bones. Calcium. But what we focus here on is the T3 and T4. So T3 and T4, they help in heart function, your digestion, your brain development, the health of your bone, muscles. Oh my god, what the heck? There's cats fighting outside my window, holy shit. Oh my god! There's two cats that started screaming outside my window. I don't know if you guys heard that. That was pretty loud. I don't know if you guys heard that. There was like cats screaming outside my window. Anyway. Alright. Okay. I see, kaya pinatake si mama na. Yeah, T3 and T4, they are the hormones produced by the thyroid. These are very important. Okay. Sama ka sa away. That's loud though. They just started screeching outside. I'm like, what the heck? Alright. Di nyo narinig. Okay, buti naman. Alright, next. Alright, this one is very complicated, okay? This is very complicated. To understand the thyroid, you gotta know how it works. And this right here is something they teach you in med school, and it is very important. Because it is like the pathway of a thyroid. I'm gonna try to simplify it because it looks kind of scary with all these words. The hypothalamus is located in the brain. Okay, so here, this is the hypothalamus. I found a picture of the brain. If you cut the brain in half here, this is how it looks like. This right here is the hypothalamus. And that hypothalamus produces a hormone called the TRH, or the thyrotropin releasing hormone. And that hormone stimulates the anterior pituitary gland, which is this right here. Just think of the anterior pituitary gland as like the balls of your brain, because it looks like a pair of balls. Look at this. This is your anterior pituitary gland. So just, you know, your brains have small balls, basically. It looks like a pair of balls, okay? So that's your anterior pituitary gland. So the anterior pituitary gland would then produce the TSH, or the thyroid stimulating hormone. Okay. And when you produce the TSH, as the name implies, thyroid stimulating, would stimulate the thyroid. And then when the thyroid is stimulated, it will produce the T3 and the T4. Yes, the balls of your brain. It is the balls of your brain. Oh, hey, Silas, you're here. Wait, let me, how do I mod you, Silas? I'm gonna make you mod. How do I give you the wrench, Silas? I don't know how to... I'm gonna give you a wrench. There we go. I think I got it. There. I got it. Silas, you should have a wrench now. Alright. So, now, what is important about this? You produce the thyroid hormones, and then it would, you know, do its job in, in some functions of the body, like increasing the metabolism, influencing growth and development, and increased catecholamine effect. I mean, well, yeah, this one. This is very scientific. Just think about... I'll show you the signs and symptoms of having too much T3 and T4 is. Okay, but this is also important. The more T3 and T4 your body has, it gives a negative feedback, meaning the more you have this, the more the hormones will tell your anterior pituitary gland and your hypothalamus to stop producing these hormones. So if you have this, a lot of this, it'll tell them, okay, stop producing the TRH and the TSH. We're a lot, we don't need more. So what'll happen is you'll have a lower amount of TSH and TRH. That's what it is. And if you don't have enough T3 and T4, it'll also do a negative feedback, and it'll tell the brain, or the hypothalamus and the anterior pituitary gland, it's gonna say, we need more! We need more T3 and T4! Produce more of the TRH and TSH. So that's what it's gonna do. So, in effect, if you have less TSH, you're supposed to have more T3 and T4. And if you have less T3 and T4, you're supposed to have more of the TSH. This is something they teach us in med school. Wrench for bonking. Oh no, Silas doesn't know how YouTube works. Don't worry, I also don't know how YouTube works. Alright. Now let's move forward. This is why we have the thyroid disorders. We have, what are T3 and T4? Those are the hormones produced by the thyroid. They're called T3 and T4. So, what is hyperthyroidism? When you have hyperthyroidism, you have too much T3 and T4. You produce way too much. Much higher than normal. Much higher than normal. So what happens when you have too much of T4 and T3? Then whatever effects it has on the body, it'll be more expressed or exaggerated, basically. Okay? So, one of the symptoms is increased sweating in hyperthyroidism. Increased sweating, increased heart rate. What is this? You get more nervous than usual, more nervousness or anxiety. And you have heat intolerance if you have increased T8, T3, and T4. There's heat intolerance. You sweat a lot. Like I said a while ago, you sweat a lot. Can't tolerate the heat. You can't tolerate the Philippine heat. You'd be sweating everywhere. And you'd be more irritable. You'll be more irritable. Okay? And wait. You will start having tremors also. Or you know, your what do you call this? Shaking. Your hands are shaking. You can't stop your hands from shaking. What's the difference between T3 and T4? Okay, T4 is mostly for it's a hormone, mostly thyroid hormone, mostly affecting metabolism, mood, temperature, basically all these things I said. It's the T4 that we watch out for the most. Not really T3, but it's both of them are the hormones produced by the thyroid, but the one we really watch out for is the T4. The T3 is also what do you call this? It's also goes to other tissues, but it can also be converted. Right? But the more important one is the T4. Okay. What else? Oh, okay. If you have hyperthyroidism, you have insomnia also. You can't sleep at night. That's it's like having too much hot coffee. Pretty much. Actually, pretty much it's something like that, but instead of, you know, when you drink coffee, it happens when you drink coffee. This one is something that happens throughout your life as long as you have high levels of the thyroid hormones. Basically. So here's a summary of the symptoms. Okay, there's a lot more. There's hair loss. So if you expect yourself, you know, you get thinner hair and you start having hair loss, that's one. Another symptom of hyperthyroidism. I already said these. There's also, you know, sweaty palms. Ayan, mapasmado dyan. That's one. If you're a woman and you have your period, you have like less blood coming out. There's also infertility, muscle weakness. You'll have weight loss. You'll have diarrhea. Your nails will be soft. And also, there's one here. This one is very much seen in a disease called Graves' disease, bulging eyes. Graves' disease is a type of hyperthyroidism where the eyes really bulge out. Oh god, that's a follow on Twitch, that beep right there. Okay. Hey, don't diss my fake PNG, Jiro. If Google can't provide me a proper PNG, I'll just take what they give me, okay? I'll just take what they give me. And if it's a fake PNG, I will take it because I can still use it. Alright. Next. Oh shoot, this is supposed to be hypothyroidism. I'm sorry, not hyperthyroidism. This is hypothyroidism. Oh no, I have a typo on my thing. If you have hypothyroidism, it means you have an insufficient reduction of T4 and T3. So it's basically the opposite of hyperthyroidism. Made a mistake here. This is supposed to be hypothyroidism. Alright. Let me I should fix that. Hold on. Let me fix that. Let me fix that. It's supposed to be hypothyroidism. There we go. Alright. There we go. Thank you for the sub. There we go. Use Brave browser for... Oh, really? Brave browser? Alright. So, hypothyroidism is the opposite of hyperthyroidism. So, if in hyperthyroidism you have fast heartbeat, which we medically call a tachycardia, in hypothyroidism you'd have a slower heartbeat, which we call bradycardia. It's slower than normal. The normal heart rate in a human being is 60 beats per minute to 100 beats per minute. Silas, shut up, Silas. Crabbing is life. So yeah, bradycardia is a slow heartbeat. So it would be slower than 60 beats per minute. If you have tachycardia or in hyperthyroidism, a tachycardia is a fast heart rate or a fast heartbeat which is more than 100 beats per minute. Okay. Next. Alright, you'll also have symptoms of arthritis in hypothyroidism. Cramming is the way. Med school students are also master crammers. Actually, yeah. It's actually in med school where I learned how to cram. Okay. If you have heat intolerance in hyperthyroidism, in hypothyroidism you would have cold intolerance, which is I don't know. I don't see much people with... Oh wait, I do see people with cold intolerance here. But you know, just because you can't tolerate the cold doesn't mean you instantly have hypothyroidism. You have to have a lot of the symptoms to be diagnosed with this. And also, you know, the laboratory tests, the blood tests to test the hormones. Because I know a lot of Filipinos who can't stand the cold. Like, because we're so used to the heat in the Philippines, we've adapted. We have advanced and mutated and adapted ourselves to the Philippine heat. That we have become... I don't know. We have become heat monsters, or I mean, in other countries, people get heat strokes at 32 degrees, and over here we get 40 degrees heat temperature, and no one's getting a heat stroke. I don't know. I don't know. We're some kind of a we're, you know, like, we're a demonic race. I don't know. I don't know. Filipinos are just something else. Okay. Next. Okay, hypothyroidism, you get more depressed. Depression is something, you know, you feel down all the time in hypothyroidism. Heat stroke. Yeah! Like, in other countries, they get 30 degrees or 32, and they get heat stroke. I've seen reports of that. I don't know why. Over here, we're like, oh, 32 degrees, that's nothing, man. Like, wait for the 40 degrees. 40 degrees and everyone wears long sleeves and pants. That's true. It's... Okay. Nagkakape pa kami, 40 degrees. I know, right? I don't drink coffee though. I hate coffee. Coffee's nasty. I drink Monster. Monster energy drink is the way. Alright. And then there's increased fatigue or tiredness in hypothyroidism. Okay. So here's another summary. It's basically the opposite of hyperthyroidism. So if you have thinning or balding hair. Over here, you'd have coarse hair or dry hair. You'd have loss of eyebrow hair, though. You will have a puffy face. You look puffy. Thyroidism large, slower heartbeat, arthritis, cold intolerance, as I said. Depression, you would have drier skin. Increased fatigability, you'll be tired more. There's also increased forgetfulness. You'll also have menstrual disorders if you're a female. Infertility also, muscle aches. And if in hyperthyroidism you have weight loss, in hypothyroidism you'd have weight gain. And if in hyperthyroidism you'd have diarrhea, here you'd have constipation. And here you'd have brittle nails. Nails that break easily. Cobra. I drink Cobra if I feel like I need a weaker energy drink. Monster is still the best one for me. That one keeps me awake. Especially if I'm on duty. I need a Monster. Mukhang exercise lang katapat. Bruh. Okay. Right, next. Alright. So, the hypothyroidism and hyperthyroidism. Those are medical. More on the effects of... those are the thyroid disorders that they can be treated medically. If you have hyperthyroidism, you have to take medications that stop the production or reduce the production of the thyroid hormones. And if you have hypothyroidism, you have to take a medication that replaces thyroid hormones so that it would normalize. So there has to be a balance of the thyroid hormones and the thyroid stimulating hormones. It's all about balance. If you have too much of something or too less of something, it can affect your body in a bad way. Cobra is weak sauce. Bacchus or Red Bull? Bacchus or Red Bull, they're the same. They taste the same to me, to be honest. I've drank both. Bacchus and Red Bull. They taste the same. They're the same to me. The best one that keeps me awake is Monster Energy Drink, which is why it's my preference. And yeah, I do have a tier list of energy drinks. A long time ago, I made a stream about that. The Lipovitan I've tried. It's Lipovitan is it used to work for me and then it's weak. But it tastes good. I like the taste of Lipovitan, but it's not as strong as it used to be. What if happened if the... Okay, I will tell you about surgical thyroid diseases, okay? I will tell you... the previous slides I showed you about hyperthyroidism and hypothyroidism, which can be treated medically. But, you know, if medical treatment doesn't work, they may need to have a surgery. Or, you know, if you have masses in your thyroid, or if your thyroid is so big that it's affecting how you breathe and swallow, you'll need a surgery for that. So, surgical. Okay, one common one is goiter. I think you guys would know this. If you see someone with a large neck mass, or someone who's walking around with, you know, parang nagbabulge yung leeg, it's probably a goiter. The goiter or a nodular goiter. The thyroid is... This is a normal thyroid size. This is a large thyroid size. So it becomes a goiter. So, yeah, here. This one is multinodular goiter. If you say toxic multinodular goiter, that means it produces a lot of thyroid hormones. So they become hyperthyroid. Produces too much thyroid hormones. It makes you it gives you hyperthyroidism. And it has little tiny nodules. This kind of thyroid disease, it needs surgery. Okay. Another one is thyroid cancer. So, thyroid cancer can look like goiter actually. You know, there are times when when there's people who present with goiter, and once you remove the thyroid, and then you look at the histopathology, it's actually it turns out to be a cancer. Yeah. But most of the time, thyroid cancer is sometimes they would just present with one nodule in the thyroid in one lobe. So, yeah. When you have thyroid cancer, you're usually hyperthyroid, produce a lot of but there are some that, you know, affect or produce less. Right, next. Yeah, this is just an image of how bad a thyroid cancer can get. This is like a cross section of the neck. So this right here is the trachea. Remember the trachea I showed you guys a while ago? This is where the air passes. This is like a cross section. Like, for example, if you cut my neck, if you cut a person's neck, this is how it looks like from above. This is the thyroid gland. This would be the cancer. So what makes cancer really bad if it's not treated is it can invade the trachea like this and actually block the airway. So this kind of cancer would of course be stage 4. Yeah. And there are different types of thyroid cancers actually. There are different types. Yeah. There's like 5 different types. The most common one is the papillary thyroid cancer. We have the follicular thyroid cancer, Hurtle cell, medullary, anaplastic, but the worst one, this is the most common and easily treated, the papillary. I see this a lot. But the worst one is anaplastic. If you get this, if the biopsy of your thyroid cancer turns out to be anaplastic, it's instantly a stage 4. Not many people, once you are diagnosed with an anaplastic thyroid cancer, it's sad to say you just consider your days numbered actually. This is the worst type of thyroid cancer. It is very hard to treat and it has a very poor prognosis. So if we get a patient who is diagnosed with anaplastic thyroid carcinoma or thyroid cancer, it's bad. It's really bad news. They will only, I think if I remember correctly, only 10% survive from this. Yeah. It's really bad. It's the worst. Yeah. Remove the what? How do we know if we have T3, T4 imbalances? You just have to, it's a blood test. Reggie Belza, thank you for subscribing. There's a blood test for it. They call it the thyroid function test. It usually includes the TSH and then T4 and T3. So, that's one way to know. Like, accurately. Aside from the symptoms you would feel. Hello, Wolf! Hello. Head transplant is the only surgical solution. Oh god. Bruh. Yeah. So, anaplastic, it's the worst one. If they are diagnosed with anaplastic thyroid cancer, their days are numbered, basically. Even if you operate on that. Usually, actually, it's so aggressive. The reason why this is the worst is because it's so aggressive that it invades other structures. Like every time we see an anaplastic thyroid cancer, it's already so advanced. They can't breathe anymore that you need to put a tube in their neck. A tracheostomy. Saguitan, hello. Welcome. Thank you for the sub, Wolf. Thank you very much. Alright. Next. Oh, wait, what? Oh. Okay. Surgical treatment. There's only one way to treat a thyroid problem surgically, and it's just basically to remove the thyroid. You don't need to remove the entire thyroid gland, though. You don't need to remove the entire thyroid gland. Sometimes you just need to remove one lobe or another. Or just part of the thyroid. Let me show you. I will show you how it's done. Oops. Oh no, that's my last slide. But I am going to show you how a thyroid surgery is done, boys and girls. So, how do you do a thyroidectomy? A thyroidectomy is the removal of a thyroid. There are different types. There's a total thyroidectomy where you remove the entire thyroid gland, the entire one, or a lobectomy. How do you clear this? Wait. Erase all ink. Or a thyroid lobectomy. Let me use a laser point. Or a lobectomy, which is this. You can use right lobectomy, meaning you remove the right lobe, or left lobectomy, you remove the left lobe. There's even something called a subtotal thyroidectomy, where you leave a portion of the thyroid. Yeah. So how is it done? I will show you all how it's done. When you do a thyroid surgery, you make the incision right over here. That's where you cut. Or basically like the creases or the folds of your neck. And then you go through the skin, the fat. There will be a muscle here. You split it open until you find the thyroid. So that's how they do it. And once they find the thyroid, what they're going to do, you know, over here, there's an artery and vein here. Artery and veins are here. Also, there's one here. There's two here. Artery and veins. Sometimes there's a thing called the middle thyroid vein over here. There's like, these are the blood vessels that supply the artery. So how do they do a thyroidectomy? What they do is, for example, you want to remove the entire thyroid. They will look for the blood vessels. Let me change the color of this ink. Wait, hold on. I'm gonna change the color of this. Let's make it green. Alright. They're going to look for the blood vessels here, and they're going to cut it and tie it. They gotta ligate that. And then they gotta ligate the vein here and ligate this. And then they try to remove this part of the thyroid. So if it's just only the right lobe, all they gotta do is just tie this, tie this, tie this, and then remove this. They can just cut the thyroid from here. And then leave the rest. Yep. Now, if they want to remove the entire thyroid, so they tie this blood vessels, they cut this off, they cut this off, they cut this off. They do the same over here. Do the same. And then you remove the entire thyroid. Sounds simple. It sounds simple. It sounds as simple as 1, 2, 3, but doing it is actually hard because the thyroid is very much attached to the windpipe or the trachea. So when we remove when we're removing the thyroid, we have to be careful of this windpipe here. We gotta make sure we don't put, you know, while we're removing the thyroid, we don't damage the trachea. It's a very delicate procedure, actually. And the thyroid is a very bloody organ. It's very bloody. Where is the carotid artery? The carotid artery is here. You'll see it somewhere, the carotid artery. Let me draw it. Let me draw it for you guys. Wait, there's a... carotid artery. Like here. Carotid artery like that. Maybe the carotid artery. Here. It'll be there. Is it the esophagus? This one right here is the esophagus. You'll see that. I lost my voice after thyroid surgery, but I got it back. Oh, I'll tell you why. I will tell you why. Why you get, why your voice is affected. Alright, let's get blue. Alright, the reason why you would lose your voice is because there is a, beneath the thyroid, there is a nerve that inserts over here, like this. It goes down. Something like that. Beneath the thyroid, okay? Those are nerves. These are called the recurrent laryngeal nerves. So if while you're removing the thyroid, sometimes you use a what do you call this? A cautery, which uses heat so that to dissect the thyroid out so that it doesn't bleed. Sometimes the heat will affect the nerves, and that's why you didn't have your voice. That's why you didn't have a normal voice for a while and it came back. It's because this one was kind of damaged by the heat. But as long as it's not prolonged heat exposure, your voice should come back like it did. Recurrent laryngeal nerve, yes, that's what it's called. These are the nerves we watch out for when doing a thyroid procedure. You do not want to damage these nerves. You do not. Bovi, yeah, a bovi. We call it the electric cautery or a bovi. Some surgeons call it a bovi. It's actually a brand though, the bovi. So you don't want to cut these. Because if you cut, for example, if you accidentally cut one, let me get another color here. Let's get red. Let's say we accidentally injured this. We injured that nerve. If you injured one side of the nerve, the patient will have hoarseness. The voice will be affected. He'll probably sound like a gremlin. He is going to sound like a gremlin. I have heard patients who had hoarseness of voice. Not really because this was cut, but just slightly damaged from trying to remove the thyroid, but they got their voice back, but they sound like growling all the time. It's hoarse. They would sound like Bakit wala akong boses? They sound like that. I had one who did. Bakit wala yung boses ko? They would sound like that. But they get better after a while. If it's not, as long as you didn't really completely damage it, if it's just like slightly damaged from the heat, it should get better after a while. Okay. Alright. Now, what if you cut both? Yeah. You did a thyroid surgery and you just, cut both. If you cut both, that's actually bad. That's even worse. If you cut both, the patient will not be able to breathe. And if the patient is not able to breathe, of course, you have to give him an airway access. Usually, this kind of thing, you need a tracheostomy, or you put a tube in the windpipe or the trachea, which is basically, let's put one. You put a hole here. Oh wait, no, not there. Actually, not there. Let me erase that. You put it here beneath the thyroid. You put a tube right here. Tube. That's a tube. Tracheostomy. And they have to breathe from there. Tracheostomy or endotracheal. Ryan, tracheostomy or endotracheal? In general, endotracheal is definitely preferred because that's just intubating from the mouth into the throat, and it's non-surgical. Tracheostomy is surgical, so it's more invasive. You actually put a hole in the trachea. But in the case of a injury to the hormones, to the nerves, you gotta use it. You have to use it. You have to do tracheostomy. Why? Because a endotracheal, it means putting a tube through the mouth, all the way into the throat. You know, intubation. That's basically an intubation where you have a tube from the mouth going down to the trachea. That's an endotracheal. That's the one when they, when you see patients who are intubated through the mouth. That would be it. That's an endotrach. They call it an endotrach. An endotrach tube. In the case of a damaged recurrent laryngeal nerves, you have to do a tracheostomy because an endotrach or an intubation is temporary. You have to remove this eventually. A patient cannot be intubated for way too long. They are very prone to get pneumonia from this. So, usually, if they are intubated for more than 2 weeks, they start suggesting to the patient to get a tracheostomy. That's why. Hello, Bucket. Yes, short-term cases. 2 weeks only. As much as 2 weeks. Because this is temporary. You're not supposed to be intubated that long. Luke Knight, just found his channel, saw your FB post. I have general physiology next semester. This stream is great help. I'll watch your previous medical streams too, if I have time, and your future medical streams. Okay, I hope you can learn stuff. I dumbed down some stuff. It's really basic stuff. I just dumbed them down for laymen because I can't get too technical. Might get too confusing, especially for some people. I mean, I know some people read about the technical stuff, but not everybody does. So I gotta keep it simple. As simple as I can. Okay. So that's it. Thyroid surgeries are actually rare. Well, not really rare, but I mean here in the Philippines, thyroid surgeries are not as common as other surgeries. We always have few of these for some odd reason. I think patients who have enlarged thyroids don't really go for a checkup. A lot of them don't really go for checkup. They just ignore it. Because if they don't feel anything, even though if they have a large thyroid, they don't go to surgery. A lot of people are like that. Yeah. To be honest, thyroid is very tricky for me. And especially endocrinology. This topic is actually one of my weaknesses. This is one of my weaknesses, thyroid. Anything about the head and neck is a weakness on my part in surgery. It's a weakness for a lot. Head and neck. Or thyroid. Walang pera. Yeah, for those who don't... well, it's weird because they go for surgery for everything else but not the... but not the thyroid. But I think it's because they don't feel anything. They see it's big but it doesn't bother them, so they don't go for a checkup. Unlike if you have gallstones, you would have abdominal pain from time to time, so it's bothersome, so they would just have surgery. This one is just a nuisance that they can tolerate. Oh, yeah. But yes, thyroid is one of the hard topics. It's a hard topic for me, actually. That's actually my last slide. You guys have any questions? I'm a 6-year dental med clinician. Ooh, dentistry. Hello. Oh yeah. Look, Thyroid, thank you for the sub. Gallstones, yeah. What surgery you consider most challenging that you performed? Okay, Kabute. Most challenging. The most challenging is the Whipple surgery, which I actually lectured on that last time. Well, in my scuffed medical education series, I talked about the pancreas, right? Whipple surgery. That's a surgery that takes 8 to 12 hours in the pancreas. The patient is still admitted, by the way. He's still there in the hospital. He's doing okay, but yeah, he's still in the hospital. We're still observing him because some things went wrong. I mean, not wrong in the sense that his life is in danger, but we gotta make sure that he's well fed and his nutrition is good before we send him home. Because, you know, like I said in my other stream, nutrition is very important. Is it prophylactic to remove both sides of the thyroid if suspected for malignant? No. No. You have to, that's why you do a biopsy first. Before you remove the thyroid, there's a thing called a fine needle aspiration biopsy. If you have first, when you diagnose a thyroid disease, the first thing doctors will do is, aside from requesting for the hormones, the TSH and the T3 and the T4, they will request for an ultrasound and a biopsy. If your ultrasound, especially if you can feel a mass on the neck, the ultrasound can tell you if the mass is solid or cystic or with fluid. And then you do a biopsy with a needle. You just poke a needle through the neck until you hit the thyroid, and then get like some cells and have it checked. It'll tell you if there's malignancy or not. That's one way. So you don't do a prophylactic. You can't do a prophylactic removal of the thyroid because you can do a fine needle aspiration biopsy. And the thyroid gland is important because it produces the hormones that your body needs to develop and for the metabolism. So that's why once you remove the thyroid, if you do a total thyroidectomy where you remove the entire thyroid, these patients have to be on medication for thyroid hormone replacement. What kind of doctor are you, doc? Okay, I am a surgeon. General surgeon. What is the difference between an FNAB and a punch needle? An FNAB, just by the name itself, fine needle. FNAB is fine needle. It's a very thin needle. Like the types of needle you use for injections. A punch needle is bigger. Actually, it's called a punch biopsy. There's also a core needle biopsy, which is like a bigger, thicker version of the fine needle. Punch biopsy is like way bigger. What is prophylactic? Prophylactic is like how do you describe prophylactic? Meaning how do I describe prophylactic? Oh my god. How will I simplify that? It's like giving something or doing a treatment just in case a disease happens. Something like that. Like for example, when you say a prophylactic antibiotic, you're giving an antibiotic to a patient even though you don't know what kind of infection he has. But you're giving it just so that you can already start something. That's what it means. I have no idea. I don't know how to explain. I don't know if you got it, but it's something like that. So if you say prophylactic surgery, it means you're doing the surgery because to make sure a certain disease doesn't happen. I mean, there is prophylactic breast surgery for those people who have the high uh, uh genetic in the family, and the genetics, they're really high risk. There we go. High risk for breast cancer. They go through prophylactic breast surgery. Yeah. You're doing YouTube streams. Yeah, it's only for medical education streams, like I said. It's not really something I'll do all the time. It's just for medical education. Like my main streams, my main platform will still be Twitch. I'll still be doing most of my streams there, my just chatting, karaoke, gaming streams there. But medical education, I'll do it here on YouTube because it will save automatically here on YouTube, so I don't have to keep uploading the VOD. I actually need to upload the Scuffed Medical Education stream VOD on YouTube. I haven't done it yet. I should do that. My mother has goiter. That looks hard to breathe. Oh no, tell her to get a surgery. Longest surgery I assisted was an 18-hour complicated craniectomy. Oh my god, that is long. 18 hours. Craniectomy. Wow. That... You know what? Brain surgeries are very, very, very delicate procedures. I've assisted those. And those are very, those are scary. Not really scary, but I mean, like, it's so delicate. It's the brain. I mean, like, just poking the brain might cause damage. I don't even want to touch the brain when I see it. Like, in a surgery, I'm like, oh my god, this is the brain. I don't want to touch it, man. I might damage the brain. Nagtanggal ng bungo. Yeah, in craniectomy, you take a portion of the skull so you can access the brain. And those kind of surgeries are sensitive to me because they actually touch the brain when doing surgery. I've touched the brain before, but I'm just scared to. I don't want to. I can like touch it for a while, and I don't want to touch it again because I feel like I might damage it. Jane Smith, they don't really return it. They replace it. Sometimes they replace it with metal. You can't really put the skull back. Sometimes they leave it open, or I mean, like this, it's just there. They close the skin, and there's a soft part of your head. But sometimes they put metal. They replace it with a metal plate. Do you still get nervous before a surgery? Not really. I don't. Not much. Are neurosurgeries more delicate than endocrine surgery? Because I've heard endocrine surgery is really bloody. Yeah, the thyroid is very bloody. But you see, consider the organ. Consider the organ involved. The brain versus a thyroid. I would be more nervous handling a brain surgery than a thyroid surgery. Because brain is a brain. The brain is the control center of your body. Thyroid is just a thyroid. I would like to touch a brain. Hello, Shojiki! Hello, hello. Neurosurgery needs no pasmado. Oh god, yeah, that's true. Imagine if you're pasmado and then you're doing a brain surgery. That is scary. Yeah. Yeah, if you guys have any questions, I can entertain them. Especially about anything, most anything. But head and neck stuff, thyroid. Thyroid is very complicated for me. Head and neck. Yeah. Ang tuli na lang mas madali, oh god. That reminds me. I think my tuli stream, my circumcision stream VOD has like 1,300 views. You guys are crazy. It has 1,300 views out of all my medical education streams. The circumcision has 1,300 views. Oh god. What's your favorite organ? What's my favorite organ? Do I have a favorite organ? I never actually thought about that. What is my favorite organ? I never thought about that. I don't know. I actually don't know. You have Tuli stream. Yeah, you can check the VODs. I have one. It's called Medical Education Tuli. I have one. You can just check my past streams. It's uploaded. It's called Twitch Stream Medical Education Operation Tuli. It's it has the most views out of all my medical education streams. I'm like, oh, out of everything, that one has the most views. What's the most relieving surgery you do? The most relieving? Is there a relieving surgery? What do you mean by most relieving? Like relieving for me or relieving for the patient? Tuli stream part 2. Wag naman. Just go, how can there be a part 2 of Tuli? once you are Tuli, you can't go back. There is no part 2. You have been circumcised. That's it. Wolverine was Wolverine was there for you. Okay, most relieving surgery for me. Uh, hmm. Most relieving surgery. This probably any cancer surgery, especially if the patient gets better. So if you remove the cancer and then the patient gets better and feels a lot better, that's something relieving, I guess. That's one. Doc, since you have mentioned that you have surgery experience, did you think that video games helped you practice better hand-eye? Actually, the video games help you in laparoscopic surgery. In laparoscopic surgery, yeah. Because in laparoscopic surgery, this is the one where you use a monitor. You have instruments. You make small incisions and then you look at a monitor. That's the one that helps with the hand-eye coordination. So I think video gamers are good at laparoscopic surgery because of, the hand-eye coordination. It's more on that. Pwede ba pa-reverse ng tulid, Doc? Oh god. You got a plastic surgeon for that. But once your foreskin is cut off, I don't think you can replace that. Antuli da tuli. Antuli da tuli. Ala. Have you chosen a specialization yet? Surgery. I want to be a surgeon. If you want to mean like a subspecialty, I want to be a hepatobiliary surgeon. Or a surgeon for the liver. Liver, gallbladder, pancreas. Ah, okay. Let me, I'm gonna go to my just chatting. There we go. Let me fix this. We're done with the... Okay. By principle, you can't revert the circumcision. You can't really. You can repair one. If you remove the foreskin, you can't really do anything about it anymore. Bile surgery. Yeah, hepatobiliary. Liver, gallbladder, pancreas. That's the kind of... It's a tough one. It's a tough surgical specialty, actually. I like to specialize in gastro. Yeah, it's interesting we got some medical people interested in the medical field here. Nice. Medical education liver when? Wait, did I do liver? I don't remember if I did liver. Did I do liver? Oh no, I didn't do liver. I did gallbladder. I didn't do liver. Wait, let me look at my medical education streams. This. Oh, I didn't do liver. I did my medical education streams. I did appendix. Appendix was my very first medical education stream. I did breast. I did wounds, small and large intestines, burns, basic life support. Oh, medical education, albulario, and other PH medical superstitions. Operation Tule. I didn't do liver yet. Actually, I know I know I did gallbladder, but it's not here. That's odd. Where did I do the gallbladder stream? Or did I not put it here? I know I did gallbladder. Let me search that. Gallbladder. Did I do gallbladder? I think I did. Oh no, I didn't. What? I know I did gallbladder. Hold on. Yeah, I did gallbladder, but it's missing. My gallbladder stream is missing. What? I know I did gallbladder. It's not here. Did I not upload that? I probably didn't upload it. Holy crap. When did I do gallbladder? I did gallbladder June. No, not June. Yeah, I did gallbladder. Can you do herbal capsules? Yeah, I did a stream on albulario and herbal stuff. I have one. You can check the VODs. I have a bunch of them here. Wait, let me show you guys. Hold on. Here we go. I have a bunch here. So my very first stream, this one was done on Facebook, and I just got the VOD, and I got the VOD and I made highlights of it, and then I actually don't have my breast stream here, but I did a rerun of the breast. It's here, and it has anus. I did anus, anus and breast. I have wounds. I have small and large intestine, burns, basic life support. This one, albulario and other medical superstitions, and then the tule, and then the thyroid. I know I did a stream about gallbladder, and it's not here. Should I? Maybe I should lecture on that again. I still Facebook streamer. No, that was like long before. That's always that last year, like the earlier days. I used to I used to alternate Twitch and Facebook because I was deciding where I wanted to stream. It was between Facebook and Twitch, and I chose Twitch. So, but I still streamed on Facebook when I was still part of Arzent. I don't know if some of you guys know Arzent in Facebook. It's an old group. I used to be part of Arzent Facebook group. No, not Facebook group. It's a, well, streaming group. I call them a streaming group. They had other streamers and VTubers there. I used to stream on their page for medical education on their page. And that's where I did the appendix and the breast. But I'm not in Arzen anymore, and Arzen disbanded, so. That was before. That was like last year. That was a long time ago. Yeah, I had a breast stream. It was very, It was the breast stream was a lot. A lot of people went to the breast stream for obvious reasons. Is Schwartz better than current for medical students? Schwartz is okay. Ryan. Schwartz is the quote unquote Bible for surgery. You go for Schwartz. First time hearing. Oh, okay. Yeah, it's an old group. Arzent. That was last year. They disbanded earlier this year, so yeah. So I think my most popular medical education stream is definitely the Tule stream. If you guys want to watch it, a lot of people enjoyed this one. So if you haven't seen it, you can go watch it. When you have free time, it's only an hour and 28 minutes. I try to keep my medical education stream short, but sometimes it gets longer if a lot of people have questions. Like for example, or it's longer when I play Surgeon Simulator, so you can just watch only the medical education part and you can skip out the Surgeon Simulator. But uh but recently I just started doing like purely medical education streams. I don't do Surgeon Simulator and as a tandem anymore. Of course people yeah, the breast. Anyway, yeah, that's a wrap, guys. It's already 10. I rewatch this during my duty. Oh god. You can rewatch my mother. I will upload the other my last medical education stream later, the scuffed one. Medical education stream random stuff. uh, anyway, yeah, I guess that's all. That's all for the medical education stream. And yeah. My next one will be my next medical education stream will be next month actually. Well, it's on December. Yeah. Because I do it monthly. And I'll have it done. I'll have it here on YouTube again. All medical education streams will be here on YouTube. Like I said. And guys, if you guys enjoy my content, especially for those who have only watched me now here on YouTube, I regularly stream on Twitch. Because I am a Twitch streamer. If you wanna watch me, you can follow me on Twitch also. I am very active on Twitter as well. So, but right now for this whole week, from tomorrow until November 14, I'm on hiatus. I have no stream scheduled for this week. I will be back to streaming on after November 14. So, yeah. If you guys want to watch me, I play a variety of games. For those who are new here, I play a variety of games. I play yeah, variety. I play FPS, I play platform, I play RPGs. Like, I play Valorant. Sometimes I play Valorant with viewers. I also play some horror games. I play anything. Almost anything. I play VR chat, by the way. I do VR chat streams. On VR. So. My next stream is after my exam. Yeah, it's after... November 14 is my exam, so it's after that. So, yeah, I just wait for... on November 14, I'll post a schedule for that week, okay? This week, I have none. No scheduled streams. So... For those who haven't followed me on Twitch, here's my link. Let me type it down. Oh, wait. http://twitch. Hold on. Let me type down my link. There. This is my Twitch link, okay? And I'm more active on Twitter than on Facebook, so if you guys came from Facebook, I post sometimes on Facebook, but like whatever I post, there is only a third of what I post on Twitter. I am way more active on Twitter, so if you guys want to follow me on Twitter, you can follow me on Twitter as well. Gosh. There, this is my Twitter. Yeah. There. Minokalo. Oh no, hello Minokalo. You missed it. You can watch the VOD. At least it's like automatically saved. Automatically saved here on YouTube. So yeah. Pon raid. Oh no, I can't even raid on YouTube. I almost said let's go raid someone, but I forgot you can't raid on YouTube. I almost said let's go raid someone, but no, you can't raid on YouTube. God, I'm such a YouTube boomer. I don't know how to use YouTube. That's why it took a while. That's why it took long a while ago. But yes, if you guys want to see more of me, I stream on Twitch. But this week I won't be. You can just wait for announcements for my streams. So probably next week, that's when I'll be streaming again. Man will raid. Link the Tulibod. Oh sure, okay. You guys want to watch the Tulibod? Alright, I will give you the link to the Tulibod, okay? For those who haven't seen it and want to watch it, want to watch about circumcision, or if you want to, I don't know, reminisce the way you were circumcised when you were younger, I will show you the link. People enjoyed this a lot. I don't know why. I don't know why people enjoyed this. I mean, I would think like people don't want to remember how they were circumcised, but apparently you guys like watching this. So here, this is the Tulibod. Okay, Tulibod. Which was done on Twitch. All right, I'm gonna watch it again tonight. All right. Okay, guys, yeah, I am done. Thank you, everyone, for coming to my stream. To my first YouTube stream of the year, I think. Was it for the year? Yeah, it's for the year. Because the last time I streamed on YouTube was last year when I couldn't stream on Twitch. Thank you, everyone. Otsupon! Otsupon. I'll see you guys sometime next week, okay? I'll post a schedule next Sunday. I have no streams this week. Okay? Bye-bye! Otsupon! Otsupon!